Mm. Hi everyone. I hope everyone is ready. Okay. So good afternoon, ladies and gentlemen. My name is Abubakar Sadiq ABASS. And for the next 1.5 hours or so, I'll be chairing this session. That is session 23 of the Congress. So you are all welcome to the session, and thank you all for joining us today. We have an exciting lineup of presentations this session. So we have 5 in all. As per our lineup, we have the following. So we're going to have a presentation by Aisha Ibrahim, Saulawa, and Nura Sulaiman, Gwaram. My apologies if I could not pronounce your names properly. And then their presentation will be synthesis of some morpholine derivatives and their acetylcholinesterase inhibition. Quite a mouthful. Yeah, and then we're going to have the next presentation by Muhammad T. Ibrahim and colleagues, and they will be talking about their topic for their presentation would be chemoinformatics integration of novel anti-Helminthic agents utilizing molecular docking, pharmacokinetics, profiling, and quantum chemical. The third presentation for this session will also be done by a group of authors led by Muhammad T. Ibrahim. Um, and then the topic for that particular presentation would be computational investigation of 1,2,3 triazole fused spirochromene derivatives as potential anti-tubercular agents. The next will be a presentation also titled Prevalence and Management of Hypocalcemia among pregnant and postpartum mothers attending the Gumel Hospital in Nigeria, Jigawa, Nigeria, Gumel General Hospital, Jigawa, Nigeria. So that will be done also by a group of authors led by Maryam Ali Ibrahim. And finally, we're going to have effects of millet-derived polyphenols and metformin on maternal serum electrolytes in pre-gestational diabetic Western rats. And that will also be done by a group of authors led by NH Sada. So without much ado, I would like to invite our very first presenter to to start. But before we begin, I would like to kindly remind everyone that, including especially presenters, that each presentation slot is limited to 15 minutes in total, and this includes the question and answer session. So I therefore encourage everyone to manage their time carefully so that we can keep the session running smoothly and on schedule. Okay, so may we have the first presenter who will be Aisha Ibrahim Saulawa. Thank you so much. You have the floor.
Okay, thank you, Dr. Abubakar.
You're welcome. Please go ahead.
Can you see the screen, please?
Yes, that's right.
Okay. Okay. So good afternoon, everyone. My name is Aisha Ibrahim Saulawa from Nigeria. And today I'll be presenting a research titled Synthesis of some morpholine derivatives and their acetylcholinesterase inhibition. These are the presentation outlines. Alzheimer's disease is seen as a progressive neurodegenerative disorder, which is being characterized by gradual decline in memory, behavior, and thinking. And in some cases, it's normally get worse over a period of time. Neuroinflammation is seen as a major cause of Alzheimer's disease and contribute to both the onset and the progression of the disease. Some studies suggest that reduced risks of this Alzheimer's disease in association with commonly used non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. The reduced levels of acetylcholine, which is a neurotransmitter in the brain, is normally associated with cognitive impairment observed in Alzheimer's disease. Acetylcholinesterase inhibition is a very important therapeutic strategy used for improving memory and cognitive function in some Alzheimer's patients. So in this work, molecular docking of some morpholine derivatives was conducted to study their protein ligand binding interactions towards acetylcholinesterase and cyclooxygenase 2 inhibition. Because understanding of the cholinesterase structure and their inhibition is very important for effective drug design and the treatment of Alzheimer's disease. So this is the scheme for the synthesis of the Schiff bases, where 2,4-hydroxyacetophenone was mixed ethanolytically with 4,2-aminoethyl for compound 1 and 4,2-aminoethyl morpholine for profile morpholine for compound 2, which is reflux for 2 hours, and after which the solution of glacial acetic acid was added and further reflux for 30 minutes, which resulted in the formation of yellow precipitate for compound 1 and orange precipitate for compound 2. So the synthesized compounds were characterized using this characterization techniques such as the FTIR, single crystal XRD, melting point elemental analysis, protein and carbon-13 NMR in order to elucidate their structure both at atomic and molecular levels. So this is showing the scheme for the molecular docking methods from the ligand preparation up to the protein ligand complex visualization, and all the softwares that were used were mentioned here. This is showing the results of the FTIR spectra of compound 1, which shows the absence of the carbonyl compound and the presence of a new azometine frequency at 1610, which confirms the formation of the Schiff base, and other bands at 2969 is being attributed to the OH and the NH vibrations, while peaks at 1453 were assigned to the carbon-carbon stretching vibrations. So a similar peaks were observed for compound 2, which further confirms the formation of the second compound. So this table is showing the results for the melting point and the elemental analysis result of the synthesized compounds, where compound 1 has a melting point of around 236 to 238 degrees, which is supersedes that of compound 2. And this indicates that compound 1 happens to be more thermally stable than compound 2. And also the elemental analysis further confirms the formation of the azometine compound. So this is showing the proton NMR for compound 1 with variable peaks at different chemical shifts, which attributes to the various neighboring hydrogen that were present. This is the spectra of carbon-13 NMR of compound 2, which shows similar chemical shifts to that of the protein NMR. And this is for the depth NMR for compound 1, which also indicates the formation of compound 1. This is the protein NMR for the second compound, which shows similar peaks with that of compound 1, and this confirms the formation of the two compounds. So this is showing the molecular docking analysis results of the compound 1 with the 2 target protein. We use 2 target proteins of the human acetylcholinesterase and that of the HAF2 in order to see the binding interactions between the synthesized ligands and that of the proteins. And this shows that the compound sits well in the active binding joints of the proteins, and also they are well cited within the hydrophobic sites of the proteins. And also for the first protein, which is the human acetyl, 3 intermolecular hydrogen bonds interactions were visualized between the protein and the neighboring proteins and that of the ligand, and also 5 others type of hydrogen bond interactions. And this is showing the visualization of compound 1 also with COX-2, showing 3 intermolecular hydrogen bonds between the neighboring protein, binding proteins, amino acid protein, sorry, and that of the ligands, and showing 1 intramolecular interactions. So this second representations is for the complex form between compound 2 and the first protein, which is that of the human acetyl, and it shows also a similar interactions, but here 1 pi sigma interactions was being observed, which was absent in that of compound 1, and 2 intermolecular and 2 intramolecular hydrogen bond interactions with the amino acid proteins also. And also for COX-2, it shows 5 intermolecular hydrogen interactions and 1 intramolecular, and also there is a sigma pi interactions. So in conclusion, 2 novel morpholine-based shift bases were synthesized, and the spectroscopic analysis confirmed the shift base formation through the appearance of the characteristic feature of the shift base, which is the carbon-nitrogen double bond. And the molecular docking studies demonstrated there is strong binding interaction of both compounds with key active residues of human acetylcholinesterase and the cyclooxygenase 2 inhibition. So the hydrogen bonding and the hydrophobic interactions were contributed significantly to the stability of the protein-ligand complexes. So this result suggests the synthesized MOPs can use as a promising inhibitory potential agents against the Alzheimer's diseases. Thank you so much for listening.
Wow, wonderful. Thank you so much. Thank you for your wonderful presentation. So from the audience, if you have questions, you can put your hands up and I will call you and then you put your question forward. But let me just, before that, let me make a comment. Mine will not be a question, but a comment, general comment to everyone who, to the next people, presenters who will come after this. If you could also, if you could, while introduce yourself, if you could tell us where your institution is or your lab, at least for us to know where you're coming from, it will also be good. Okay, so those with questions can put up their hands up.
I think there's no provision for raising hand here.
Sorry, are you asking a question?
So you say one should raise his or her hand before asking question, and I can't see where to raise hand here. So
Okay,
that's
okay, you go
why.
ahead. Okay, okay, go ahead, go ahead. Just go
Okay,
ahead.
Dr.
Yeah, if you
Aisha,
look at the react.
thank you
Okay,
for
you
your
sorry.
timely presentation. So I'm Muhammad Ibrahim. I have just one observation regarding to your molecular docking results. You did not present your docking scores.
Okay. Pardon?
I say you did not present your docking scores for the two compounds.
My documents. Okay, okay.
You just
So that
give us
will
the
not bombard the presentation, but it's
presentation.
available on the article.
No problem. It's just an observation I made.
All right, thank you so much for that.
You're welcome, and thank you.
All right. So if you have the next question, we can take the next question. If there are no more questions, then we can move on to the next presenter. If the next presenter is available now, the person can
Okay,
can
thank
take
you,
over.
Doc.
Sorry?
I say thank you. I'm the next presenter, sir.
Oh, okay. All right. So um can you take off your share? Can you unshare your screen? Aisha
All right.
Ibrahim Saulawa.
All right.
All right, thank you. So yes. Yeah, so Mohammed T. Ibrahim, yeah, you can take over now.
Sorry, I'm trying to share the screen.
All right.
Okay, please, can you see the screen?
Yes, we can see. I can see the screen. I'm sure everyone else
Okay,
can.
okay. Good afternoon, everyone present. Muhammad Ibrahim from Department of Chemistry, Faculty of Physical Science, Ahmadu Bello University, Zaria, here to present my paper, or one of our papers, titled Chemoinformatics Integration of Novel Anti-Helminthic Agents Utilizing Molecular Docking, Pharmacokinetic Profiling, and Quantum Mechanical Simulation on 1,2,4-triazole derivatives. The helminthic disease serves as a worldwide burden, with about 1.5 billion people being affected by this transmitted disease, out of which 880 million children worldwide, 350 million in Africa need treatment against this particular disease. And the three key pathogens that are associated with this disease are Ascaris lumbricoides, Trichura, and then hookworms. As such, this infectious disease has been classified as neglected tropical disease, which is causing diarrhea, anemia, fatigue, and abnormal pain, with a global burden exceeding malaria and tuberculosis. Why need for new drugs, or why they need for new drugs? Current treatment rely on a limited arsenal, which are mentioned Albendazole, ivermectin, praziquantel, dihydrocarbazine, and ultimin are the drug line treatment for this disease. Then, by the emerging drug resistance in veterinary medicine and similar trends in humans, urgently demands need for the new therapeutics. As such, computer-aided design offers a promising efficiency pathway for discovering and optimizing new anti-helminthic compounds. The study objectives and methodology. Uh, in this study, a sum of 22 triazoles derivatives were sourced from literature, and they were drawn using ChemDraw and optimizing Spartan 14 software to get the stable conformation of these compounds in order to investigate their mode of interaction against a target receptor, which is T-Gondi receptor, with a PDB ID of 8J64. After that, ADMET profiling and drug likeness were evaluated using the Swiss ADME and PKCSM online web tools. Then finally, DFT analysis were used for the computation of the quantum mechanical descriptor at dimension level of theory. Results and discussion. The binding mode of these studied compounds, which range from -118.80 to -128.9 kilocal per mole across all the 24 compounds were investigated. And the best 5 compounds are tabulated in table 4, which are going to be presented. Out of the 22 compounds, the 5 compounds presented have the highest binding affinity, among which compound AH15 has the Moldog score of -128.98 kilocal per mole, which interacted with the amino acid residue in the active side of the receptor via hydrogen bond interaction and hydrophobic interaction with the specified amino acid residues as presented in the table. Then followed by compound 13, then 14, 16, and 22. Figure 1 presents the 2D interaction of the best three compounds, which is compound AH15 and AH13 and AH16, to clearly visualize the nature of hydrogen bonding and hydrophobic interactions between the specified compounds and the amino acid residues in the active site of the receptor. Then furthermore, drug likeness following the Lipinski's rule of 5 was further evaluated using the Swiss ADME in order to see the compliance of these compounds with the Lipinski's rule of 5. And the rule says that any compound to be orally viable must satisfy the following. 1, molecular weight has to be less than 500 or equal to 500. Number of hydrogen donors should be less than or equal to 5. Number of hydrogen acceptors should be less than or equal to 10, and the lipophilicity should be less than or equal to 4.15. Upon all these reported compounds, we have one violation, which is the lipophilicity index of greater than 4.15, which further confirm that these compounds are orally bioavailable and drug-like in character. And all of them have a bioavailability score of 0.55, which indicates their conformity with the drug Lipinski's rule of 5. Then the ADME pharmacokinetic profile of these compounds were further evaluated, and all these compounds were seen to have a human intestinal absorption within the accepted range, which is beyond or above 30%. And then they have their brain barrier permeability within the range of minus 2.0 to 1.5, if I'm not mistaken. And then they all seem to be able to permeate through the central nervous system. And also, all these compounds were all seen to be substrates of cytochrome A304, which is a very important key in the ADME pharmacokinetic profiling, except compound 15, AH15 and then AH16, which were seen to be not in compliance with these. Okay, sorry, with compound 13, 14, and 22, which are not to be in compliance with this parameter. And then among these 5 compounds, 3 compounds were seen to be non-toxic, while other 2, compound 15 and 16, were seen to be toxic, which indicates that these 2 compounds may have problem when used as drug. And then figure 2 further shows the map, which is a molecular hydrostatic potential map of compound 16, which is the most reactive compound among the 3 presented compounds. If you look at the trend of the reactivity, which is being studied between, which is the difference between the, which is being ascertained by the energy gap between the HOMO and LUMO of any compound. The compound 16, which is the most reactive compound, has an energy gap 3.62 electron volts, while that of 15 has a 3.92 electron volts, and then the other ones have 4.2, 5.04, and 5.16, which are the least reactive among the reported compounds. As such, compound 16 is said to be most reactive compound among all the studied compounds. Conclusion: molecular taking was performed between 24 compounds and a receptor targeting which serve as a target for the helminthic disease. Out of these compounds, compound AH15 was seen to be the best compound, which interacted in the active site of the compound with a mole score of 128.98 local per mole against the receptor, which is toxoplasma gondii. And then drug likeness profile of these compounds were ascertained to have only one Lipinski's rule violation, which shows that these compounds are orally bioavailable. And then the quantum chemical calculations further indicated that compound 16 is the most electronically reactive compound with a small energy band gap of 3.62 electron volts, which confirmed by the DFT calculations. Thank you all for listening.
Oh, thank you so much for your great presentation as well. So I will now invite questions from the audience. So if you have any question, you can go ahead and ask. Okay, it seems we don't have questions. Then straight away, let's move on to the next presenter.
Okay, I'm going to video.
As we
I'm presenting the second
okay.
paper.
Oh, okay, okay, all
Okay,
right. So let's go ahead then.
okay. Okay, permit me to stand on the existing protocol. Our second paper titles Computational Investigation of 1,2,3 Triazole Fused Spirochromene Derivatives as Potential Anti-Tubercular Agents. Tuberculosis crisis globally is also termed as one of the neglected tropical diseases which infected global
Are you going to
people.
share your screen?
Okay,
Sorry,
I've
excuse
shared the
me.
screen.
Are you going to share your screen? No,
I've shared
we
the
can't
screen.
see your screen.
Okay,
I can't see your screen. You can share again.
okay, let me. What about now? Are you seeing the screen?
No, if anyone else is seeing, the person should let us know. Otherwise,
Oh,
try
okay, let me
on
share it
sharing and
again.
sharing. Yes.
Okay, sorry.
So,
Are you seeing the
okay,
screen
I
now?
think it's coming up. It's coming up
Okay,
now. It should
okay.
come soon. No, not yet. Not,
Up to now? What about
no,
now?
still. Yeah, what's
Oh,
happening?
subhanallah. Okay,
Mm,
sorry, let me close the file and open
y-
it again.
Yeah, yeah. Mm.
Okay, are you seeing the screen now?
Yes, yes. Now we can see the screen.
Okay, okay. Sorry for the obstacle.
That's fine. It's okay. No worries.
Tuberculosis is also one of the neglected tropical diseases with about 1 in 3 people infected with tuberculosis. About 1.1 million deaths, including 400 HIV patients, were recorded in 2014. And 90% of extensive drug resistance, especially,
Um,
are
sorry.
recorded.
Your slides are not moving. If you are aware,
Yes,
just to
okay.
let you know. Okay,
Okay. What about now?
okay.
Are they
I
moving?
thought
No, I'm
still
not
not
done with
moving.
the post slide.
We are still on the front first page, the cover page.
What about now?
Still.
Subhanallah. What about now?
Mm.
But it's moving in my from my side.
Okay. Yes. Now it's moving. Now it's moving. So we can move on.
Okay,
Maybe it's the internet. Yeah. Okay.
okay. It's moving, right?
Yes. Yes. Now it's moving. So we can go ahead.
Okay, I'm coming.
Wow, what's happening?
Okay, are you seeing it now?
Yes. Yes.
It's moving,
Yes.
right? Okay, the research,
Try
the
moving, let me see. Because it's still at it's not at it's at the presenter view. So, I mean, the PowerPoint view. It's not at the um, slideshow view.
okay,
So we can see your ribbons on the left-hand side.
okay,
But
I'm
if you want,
coming.
you
Sorry,
can continue that way.
let me share it again. Okay, it closes. What about now? Are you seeing it? Is it moving?
No, no, it's not. It's not up. It's not even up yet. Oh, now I don't know. It's still not
Mhm. Oh, what's
showing.
wrong with it?
Okay,
What
yes,
about now?
now, yeah, now it's showing. So you
Okay.
can continue.
Can I continue?
Yeah, continue this way. It's
Okay.
fine.
The rationale behind this and the objective of this is combined is because uh, there has been drug resistance by these anti-tubercular agents. So we intend to also investigate, use computational techniques to investigate some compounds to see whether they are promising anti-tubercular agents. So the research is going to be carried out via molecular docking screening of these compounds against uh, energy reductants, and then the drug likeness of these compounds is going to also be evaluated, and depth activity calculations is going to be conducted as well. And this is the workflow of the methodology. So we are going to prepare the structures by downloading the structures from the literature, growing, optimizing, and then saving the structures in PDB file format, which is the file used for molecular docking. And then the software will also be downloaded from the protein data bank, and it will be prepared before carrying out the docking. And after the preparation, the docking is going to be performed using multiple virtual Docker, and then DFT and admin analysis will be conducted. Finally, results. Among the 15 compounds investigated, the best 5 are presented due to time constraint. The range of the molecule between these presented compounds ranges from minus 101.859 to 107.287 kilocalorie per mole, out of which compound 14 is seen to be the most promising compounds among the investigated compounds with a molecular score of minus 107.287, and it was found to interact with the amino acid residues in the active site of the receptor via hydrogen bond and hydrophobic interactions. All other compounds except compound 13 follow the same sequence of interaction, except that compound 13 has no hydrogen bond interaction, but only hydrophobic interaction. Yeah. The lead compound is now visualized in order to clearly see the amino acid residues and how they interact in the active site with the amino acid residues present in the active site of the receptor. And this compound was seen to have interacted favorably in the active site of the amino acid residues. Then drug likeness of these compounds were further evaluated using the Lipinski's rule of 5, which you can see that all the compounds except compound 14 and 9 have one violation, which is the lipophilicity, which indicates that these compounds are orally bioavailable with a good oral bioavailability score, most especially the best compound, which is compound 14. And then the ultimate properties of these compounds further indicated that these compounds have their intestinal absorption greater than 90, which is well above the 30% threshold. And all of these compounds were seen to have primary permeability greater than -1 and central nervous system greater than -2, which indicates that they can penetrate through the brain barrier and central nervous system. Then the metabolism and excretion of these compounds further indicate that these subcompounds have both substrate inhibitors of CYP with a total clearance within the permissible limit. And all the compounds were seen to be negative for the AMES toxicity, meaning that none of these compounds is mutagenic and they all have low toxicity effect or risk. Then the DFT calculation, which further indicates the reactivity analysis of the compounds, which says a lower band gap indicates higher activity and lower stability. And among these compounds, compound 14 was seen, sorry, compound 3 was seen to be the most reactive compound, which has a energy band gap of 4.4 as compared to other compounds with energy band gap of 4.6. And this indicates that this compound is the most reactive among the investigated compounds. Conclusion: based on the molecular decking studies, it is confirmed that compound 14 has the most favorable interaction in terms of mole score against the studied receptor, which is redoxin for the treatment of tuberculosis. And then drug likeness and safe admit property of these compounds further indicate that these compounds have good drug-like and they are safe for use as potential drugs. And based on the reactivity analysis, compound 3 was seen to be the most reactive compound as confirmed by the quantum chemical descriptors investigators. So processing promising candidates in terms of this can be used as a anti-tubercular agent when subjected to in vitro and in vivo and in vitro investigation. Thank you.
All right, thank you so much once again for yet another great presentation. Wow, interesting to note that we are doing such great research, yeah, over there in our part of the world. That's good to know. Very impressive.
Thank you, Doc.
Yeah. So yeah. So if you have questions, please go ahead and ask. Otherwise, we'll move on to the next presenter. But let's wait a bit to see if we have questions. Um,
I have question, please.
yes. All right. So
Okay.
please go ahead.
It's not a question, actually.
Okay.
It's like an observation. Can you hear me?
Okay. Thank you, Madam Aisha. I can hear you.
Yeah, thank you so much. That was a very nice presentation by you. Or were
Thank
you
you.
able to perform any docking validation, such as
Okay.
the docking the ORMSD analysis to confirm if the docking protocols were actually fit with your compounds?
Okay. Actually, the redocking or the docking protocol validation has not been carried out. Why?
Okay.
One, because Mulgo Battle Docker has been one of the most accurate or precise docking software. So sometimes one need to, because it has been established that it has about 85% precision as compared to other molecular docking programs.
Okay. Okay. Thank you so much.
Okay, thank you, Madam Aisha.
All right. So any more questions? But before that, let me just make this announcement. I'm sure, yeah, there's an announcement here. I don't know if you all can see that, but after the last presentation, I would kindly like to plead with you to switch on your camera so we take a screenshot, as it were, a selfie if you like. Yeah.
No problem, Doc.
Thank you so much. So
Thank
if
you.
we have the next question, we can take the next question. All right, so it appears we do not have any further questions. So permit me to invite the next speaker, the next presenter, who would be, I don't know from the authors whether it is going to be Maryam Ali Ibrahim or Zainab Yusuf Makama, Rabia Mohammed Atta, and Jafar Farouk. Which of them will be presenting?
I'm
The person can go
presenting.
ahead. Oh, okay. Please go ahead and share your screen and then you can start. Yes, you can see your screen. So yeah, you can go ahead.
Good evening, everyone. My name is Zainab Yusuf Makama, a fifth-year medical student from Near East University, Northern Cyprus. I'm presenting on prevalence and management of hypocalcemia among pregnant and postpartum mothers attending Gumel General Hospital in Jigawa, Nigeria. Hypocalcemia is a medical condition with a serum calcium level less than 8.5 milligram per deciliter or ionized calcium level below 4.5 milligram per deciliter. Calcium plays an important role in the human body. This is because it contributes to numerous essential physiological processes such as muscle contraction, nerve transmission, hormonal regulation. It also helps in fetal bone development during pregnancy, and it's essential for lactation during postpartum period. Maintaining calcium balance, also known as calcium homeostasis, involves regulating both the albumin-bound and free, that is ionized calcium, within the intracellular and extracellular spaces. The aim of this study was to assess the frequency and treatment approaches for hypocalcemia during pregnancy and in postpartum women. The objectives were to determine the prevalence of hypocalcemia among pregnant and postpartum women attending Gumel General Hospital, to identify the management strategies adopted in their treatment, and to evaluate maternal and neonatal outcomes associated with hypocalcemia. This study was carried out at Gumel General Hospital, Jigawa State in Nigeria, and it's a retrospective cross-sectional study using medical records from Gumel General Hospital. The study populations are pregnant and postpartum women who attended Gumel General Hospital and were diagnosed with hypocalcemia from January 2024 to December 2024, where a total of 83 patients' records were analyzed. We obtained ethical approval from Jigawa State Ministry of Health, Research and Ethics Committee. Here are our results. Based on the age distribution, the finding shows that hypocalcemia occurred most frequently among women aged 20 to 24, accounting 30.1%. The p-value is 0.4, therefore there is no significant relationship. Based on the pregnancy status, pregnant women have the highest prevalence of 63.9%, while postpartum had 36.1%. It is also non-significant because the p-value is 0.07. Now, in terms of the reproductive characteristics, hypocalcemia, according to this study, hypocalcemia was more common among para-2 women and in primiparous women. And similarly, gravidity, it is most common in primigravida and gravida 2 women, accounting 19.3%, while a notable number of cases were also recorded in the postpartum period. With regards to the gestational age, the highest gestational age was seen among women in their third trimester with prevalence of 41%, and the least in first trimester, 1.2%. Geographically, hypocalcemia rate was highest among women residing in rural settings with a prevalence of 59%, and clinically, the most common presenting symptom was found to be muscle cramps with prevalence of 80.7%. Their serum calcium was documented, and laboratory findings showed that the majority of patients had serum calcium level in the range of 6 to 8.4 milligram per deciliter, accounting the highest, that is 69.9%. And the leading identified risk factor was found to be dietary calcium deficiency with 71.6%. Documented comorbidities, the most documented one is preeclampsia, accounting 10.8%. However, majority of the comorbidities were not documented. that is 63.9%, were not documented. In terms of the management, all patients receive treatment, and it's a combination therapy. They receive more than one treatment, with oral calcium supplementation and intravenous calcium gluconate being the most commonly used interventions. And most patients, that is 85.6%, receive treatment for less than a week, and the follow-up practices were suboptimal, with only 18.1% having documented follow-up, whereas the majority, 60.2%, were not documented. Based on the maternal and neonatal outcome, the maternal outcomes were generally favorable, in which there is no recorded death, but muzzle tetany is accounting 35.9% of the maternal outcome. Neonatal outcomes were poorly documented, 96.4% likely records. Discussion of findings. These findings show that hypocalcemia occurred most frequently among women aged 20 to 24 years, accounting 30.1%. This indicates that younger women in their early reproductive years are more affected. However, a study shows that it's mostly seen among women aged 20 to 34 years. That is 77.1%. And in terms of reproductive characteristics, hypocalcemia was more common among para-2 women and primiparous, suggesting that both first-time mothers and those with moderate parity are more vulnerable. However, a study shows that the prevalence of hypocalcemia increases with parity. The analysis of gestational age further revealed that hypocalcemia was most prevalent during the third trimester and postpartum period. But a study shows that the prevalence was in the second trimester, accounting 55.2%. Clinically, the most presenting symptom was muscle cramps, accounting 80.7%, while another study showed that headache has the highest prevalence of 53.5% as the presenting symptom. Regarding management, all the patients received treatment, with oral calcium supplementation and intravenous calcium gluconate being the most commonly used intervention. However, in a case report, combination therapy using intravenous calcium gluconate and intravenous magnesium sulfate were used to treat a patient. Maternal outcomes were generally favorable with no recorded deaths. However, complications such as maternal tetany, 35.9%, were observed, while in neonatal outcomes they were poorly documented, 96.4% likely records with 0 low birth weight. In comparison with another study, which observed that most maternal outcomes result in cesarean delivery, while neonatal outcomes recorded low birth weight, the fewest outcome. In conclusion, these findings indicate that hypocalcemia is a common condition among young reproductive age women, particularly during late pregnancy and postpartum period. And among the documented and presumed contributing factors, dietary deficiency was most commonly identified. While treatment outcomes are generally positive, there is gaps in follow-up and documentation, particularly for the neonatal outcomes. And this highlights the need for improved documentation and stronger hospital records. Thank you. These are our references.
Oh, great one too, mashallah. Nice. Thank you too. Thank you so much for your great presentation. Yeah, so I will now we have always done, we'll invite questions from the audience. So if you have any question, please go ahead and ask. Okay, it appears we do not have, we do not have questions. But just a general comments for myself. Yeah, I noticed in your presentation quite an interesting one. You highlighted more on non-significant results, but I found also some other results that were significant. Maybe you may want to highlight on those ones maybe next time or so because they appear to be quite interesting. I mean, so yeah, you can focus on the more interesting ones and then and highlight on those significant ones too as well. Yeah, so that is just it. Thank you so much for your presentation. It was quite an eye opener.
Thank you.
Yeah, so yeah, so we will invite the next presenter, which happens to be our final presenter. Right? So that should be coming from NH Sada, A Mustafa, II Muhammad, ZW Sulaiman, HA Mikhail. So if and then there's I Isaka and Abdulrazak. So if if the presenter is with us here, the person can go ahead to present. So you may want to unshare your screen. Okay, yeah, I think it's gone. So may we have the last presenter now? Or we do not have the presenter for the last presentation. Okay. It appears we do not have the last presenter with us. So now what I will do is to kindly request from you to switch on your camera so we could take a selfie. I mean, yeah.
A moment, please. I am preparing the screen.
Okay.
Okay. 3, 2, 1. Professor. Okay. 3, 2, 1. Okay, it is taken. Thank you.
Okay. Thank you. All right. Thank you, everybody, for your contributions. We truly appreciate each and every contribution that you have made here, and we look forward to seeing you again next year. Thank you so much.
Thank you so much, Doc, for the opportunity given to us as well. Bye-bye.
Thank you. Bye-bye.
Thank you, sir.